Hi, you're watching COVID updates on Voice of Canada, and this is Sana Haroon. The Toronto Blue Jays are set to face bigger crowds at the Rogers Centre this week, as relaxed COVID-19 capacity rules will finally allow 30,000 to watch in the stadium, double the amount that was allowed previously.
The Blue Jays' nest is filling up. This week, capacity at Rogers Centre will increase from 15 to 30,000 fans, a decision that was made after Ontario's vaccination rate surpassed 80%.
I'm confident that we can do this safely and slowly and cautiously because we all need balance.
The one caveat is that everybody entering the stadium will have to show proof of vaccination. Like it or not, infectious disease specialists say it's the only way any of this will work.
Even if we go back a couple months ago, a lot of places weren't talking about vaccine passports. But more and more, we're realizing that that's really the way out of this pandemic, to keep employees and the patrons safe.
So for fans, it's straightforward. For athletes like Toronto-born NBA star Andrew Wiggins, it can be complicated. Wiggins is the lone vaccine holdout on the Golden State Warriors, which play in a San Francisco arena with very strict passport rules. The NBA denied him a religious exemption, so unless he gets vaccinated, he can't play in any home games, which will impact his $31 million annual salary.
His decision is kind of like a case study as to how sports and companies and organizations deal with individuals who, I don't know how someone wants to even describe what he's doing, because it's such a touchy subject right now.
Other leagues have used the carrot and the stick approach, minus the carrot. The NFL's vaccination rate is 93%, in large part because the rules for unvaxxed players are so strict. Still, there are holdouts.
I respect everybody else's decision, and I just ask that everybody does the same for me.
And this week, a handful of NHL teams ran into the same issue. Some sent their unvaccinated players to the minor leagues, citing headaches with border restrictions and quarantines. All things nobody wants to talk about anymore.
Way above my pay grade. Way above my career. I'm not going to talk about vaccinations, COVID. I want to talk about hockey.
When the COVID-19 pandemic began, some people adapted paths in a way to avoid the isolation that came with social distancing for many. But now that people are returning to work and resuming travel, caring for paths is much more challenging than when many were adopted at the start of the pandemic.
Play quieter. Call it creature comfort. Shut in by the pandemic, people all over turned to animals.
Just innocent, loving pets that just want to be loved. And that's what I needed too, so it worked out.
Pet adoption spiked when human contact wasn't an option. Linda Wynn says she wouldn't know what to do without her beloved dogs. But for others, priorities are shifting. Many are back working at the office, people want to travel and go out. The UK's largest dog welfare charity has seen traffic on its Giving Up Your Dog page jump 100% in the past 6 months. Calls about surrendering animals started just after July 19th, when nearly all restrictions in England were lifted. So far, dogs aren't being returned en masse, but the group fears that wave could be coming. Canadian groups such as the Toronto Humane Society says thankfully it hasn't seen a similar increase in calls. Rehoming pets is incredibly hard. In Germany last month, one animal group turned to Tinder. Yet Tinder, the dating app. The Munich Animal Welfare Association thought maybe someone would swipe right on a good boy. Jillian Moss says, quite simply, it's fun. This is something new, something creative, which we definitely support. Support is something animal shelters are always looking for. The pandemic at first seemed to lead to so many perfect matches. Now agencies fear they'll need to dream up even more creative ways to rehome pandemic pets, even after they provided their humans with the love and support they needed.
The term waning immunity has picked up steam recently, with many countries using it to push for a rollout of COVID-19 booster shots. Waning immunity refers to a decline in antibodies over time after receiving a vaccine or getting an infection, something that is completely normal.
Lots of Canadians have received both shots of a COVID-19 vaccine. For many, it's been several months since their second shot, leading to concerns about waning immunity.
The term waning immunity is a little bit deceiving and has a more negative connotation than it really deserves.
Associate Professor Matthew Miller says waning immunity refers to a decline in antibodies over time after receiving a vaccine or getting an infection, something that's completely normal.
When we get vaccinated, what we're doing is we're telling our body to respond as if we had an infection by making lots and lots of immune cells to protect us. That also happens, obviously, when we get naturally infected. But after that infection goes away, we don't want to maintain all of those, because if we did that for every infection that we've ever seen over the course of our lives, our body would just run out of space and energy.
But he says our bodies don't completely lose the antibodies.
It keeps on reserve a smaller number of cells that are capable of responding very, very rapidly if we ever encounter that pathogen again in order to protect us.
Immunology professor Jennifer Gumerman says the misunderstood concept of waning immunity has many people worried about needing booster shots.
The booster shot should be considered first and foremost for people who maybe didn't make such a strong response to the original vaccination regime,
which includes older seniors and the immunocompromised. She says studies show the two-shot COVID-19 vaccines are protecting the general population well against the virus and variants, even months after getting the second shot. So we don't need to worry about getting booster shots in the near future.
I don't think we're there yet, but we're obviously monitoring the immune response.
Gumerman says a better tactic is to distribute vaccines to people worldwide who haven't received any shots yet and prevent new variants from forming.
This is now a pandemic of the unvaccinated. Not only are the vaccines going to protect you, but there is evidence that they can reduce transmission.
An Ontario doctor is under fire with Health Minister Christine Lloyd after she demanded an investigation into reports that he was handing out COVID-19 vaccine exemptions letter for a $50 fee.
Eating indoors at a restaurant or shopping mall food court now means showing proof of vaccination and some government identification. Not a big deal for most people.
Do you guys report on the truth?
But those in this group barged into a Scarborough shopping mall eating area, masks off with no proof, claiming the rules don't apply to them. For those looking for a less public way around the rules, some are turning to doctors in search of a medical exemption letter, something the doctor can write.
All that we know is that there was a big lineup, a lot of people at the clinic on Saturday.
Social media reports said one doctor was offering exemption letters to patients widely. The $50 fee wouldn't be against any rules, but if the patient didn't qualify for medical reasons, that could be a cause for discipline. Family doctor Christopher Hassel was allegedly offering those letters. Within hours of word getting out, he left the practice where he worked every Saturday.
He would not be practicing at the clinic for now.
Did he deny that he was handing out these notes for a fee?
We did not have a conversation to that effect.
Dr. Hassel is a licensed medical doctor and calls himself a herbalist. 7 years ago, Dr. Hassel agreed to restrictions on his ability to prescribe certain drugs, like narcotics and other medications. We went to his former home and office in Richmond Hill, but it's been closed down for 3 years. A sign on the window says it's been repossessed by lenders. Ontario's health minister has asked for an investigation into the allegations. The College of Physicians and Surgeons, which regulates doctors, told us, although we are limited in what we can publicly disclose at this point, we will take all appropriate actions based on what we determine in these initial steps. There's no system in place to keep track of which doctors are writing medical exemptions and in what numbers. documents that would help people get into areas that now require proof of vaccination or exemption. Although these diners prepared to openly flout the rules did so without being kicked out of the mall or arrested.
Just when Canadians thought they had their hats wrapped around all the COVID-19 shots available to them, vaccine makers decided to throw a curveball and rename them. Pfizer, Moderna and AstraZeneca have all renamed their shots from the manufacturer's name to a new brand name.
As you can see, they're not the easiest to remember or pronounce, leading to a lot of criticism. Many people are wondering why the manufacturers decided to rename the vaccine. Don Bodish, Canada Research Chair in Aging and Immunity, says renaming of vaccines is common.
It's very common for these things to have a brand name and very uncommon to use the manufacturer's name.
She says typically manufacturers take care of labeling before releasing the vaccines, but since they had to deliver the shots in a rush under emergency approvals, they had to shift their priorities.
They were getting the job done to get these vaccines to market as quickly as they can.
Bodish says picking a brand name is a more accurate approach.
The slang we've already picked up is going to be hard to remove, but it's not really a very accurate or a way of referring to the vaccines.
She says it will also eliminate confusion when new versions of the vaccines are released.
There may be a booster specific to new variants. There may be ones that are tailored to...
US President Joe Biden received his third shot of the Pfizer COVID-19 vaccine on Monday, days after the Centers for Disease Control and Food and Drug Administration endorsed booster shots for millions of vulnerable and older Americans.
Did you ever think you'd be senior press coming to watch someone get a shot in the old days? Me either. At any rate, like I did in my first and second COVID-19 vaccination shot, I'm about to get my booster shot and do it publicly. That's because the Food and Drug Administration, the FDA, the Center for Disease Control and Prevention, the CDC, looked at all the data, completed their review, and determined the boosters for the Pfizer vaccine, others will come later, maybe, I assume, but the Pfizer vaccine are safe and effective. They've had all the data they need. And last week they laid out who is eligible for those boosters for now. You're eligible for a booster if it's been 6 months since your second Pfizer shot, and if you fall into one of these categories. People over 65, which is hard to acknowledge, adults, I'm only joking, folks, adults with certain underlying health conditions like diabetes and obesity, and those who are at increased risk of COVID-19 because of where you work or where you live, like healthcare workers, teachers, first responders, grocery store clerks. If you fall into these categories, you're eligible for the booster. Now, I know it doesn't look like it, but I am over 65. I wish I, way over. And that's why I'm getting my booster shot today. The booster line is if you're fully vaccinated. The bottom line is that you're fully vaccinated and you're highly protected now from severe illness, even if you get COVID-19. You're safe, and we're going to do everything we can to keep it that way with the boosters. But let me be clear, boosters are important, but the most important thing we need to do is get more people vaccinated. The vast majority of Americans are doing the right thing. Over 77% of adults have gotten at least one shot. About 23% haven't gotten any shots. And that distinct minority is causing an awful lot of us an awful lot of damage for the rest of the country. This is a pandemic of the unvaccinated. That's why I'm moving forward with vaccination requirements wherever I can. On Wednesday, I'll be traveling to Chicago to talk about why it's so important that more businesses are instituting their own vaccine requirements. We know that to beat this pandemic and to save lives, to keep our children safe, our schools open, our economy going, we need to get folks vaccinated. So please, please do the right thing. Please get the shots. And it can save your life. It can save the lives of those around you. And it's easy, accessible, and it's free. So text your zip code to 438829. That's 438829. Or visit vaccines.gov to find a vaccination location near you. We can do this. Get vaccinated. Thank you very much. Now I'm going to get my booster shot, and right here, and the major is going to give me the shot. No, I haven't any side effects the first or the second shot, thank goodness. I don't anticipate one now, but we'll see. Is that high enough for you? Okay.
Is the First Lady giving hers as well today, Mr. President?
She's going to get one. Not, I think she's teaching that, but she's going to get one, yes.
Mr. President, what do you say to world health leaders like the World Health Organization who say wealthy nations should help more countries without vaccinations get vaccinated before they get boosters here in America?
We are helping. We're doing more than every other nation in the world combined. We're going to have well over 1,100,000,000 shots, and we're going to continue going. We're going to do our part. We've also given a great deal of funding to COVAX, which is the vehicle that does this. So we have plenty of opportunity to make sure we get everyone in the world to play our part, the largest part in the world of getting everyone vaccinated.
How many Americans need to be vaccinated for us to go back to normal? Like, what is the percentage of total vaccinations that have to be deployed?
Well, I think, look, I think we get the vast majority, like is going on in some industries and some schools, 97, 98%. I think we're awful close. And, but I'm not the scientist. I think, but one thing for sure, a quarter of the country can't go unvaccinated, and us not continue to have a problem.
Any progress on a reconciliation deal today, Mr. President? How close do you think you are?
You know me, I'm a born optimist. I think things are going to go well. I think we're going to get it done. And but I have meetings tonight, tomorrow, and for the next little bit.
What is the stake for your agenda and your presidency with what's happening on the Hill this week?
Victory is what's at stake.
Mr. President, how would you define success this week legislatively? How would you define success legislatively by the end of this week?
Well, it may not be by the end of the week. I hope it's by the end of the week. But as long as we're still alive, we got three things to do: the debt ceiling, continued resolution, and the two pieces of legislation. If we do that, the country's going to be in great shape. Thank you.
What's your message to Democrats as you have these calls? What's your message to Democrats, Mr. President?
Vaccine passports are a reality in most provinces across Canada and are now required in British Columbia, Manitoba, Ontario, and Quebec.
Bill Mafuz and his staff just want to be safe while serving up sandwiches. But during the first week enforcing Ontario's proof of vaccination program, he's already faced violence.
And he threatened to come back and fill up his truck with bricks and destroy the place.
The anger, he says, has come in person, online, and over the phone.
It's just really unfair and to take out frustrations on these young adults, you know, trying to work.
Outside Calgary, threats forced this restaurant owner to temporarily close to indoor diners entirely.
The comments that were coming at us were significant enough that we didn't feel confident or safe in opening the doors and having our staff having to deal with this backlash.
Vaccine passports are a reality in most provinces and already required in BC, Alberta, Manitoba, Ontario, and Quebec.
It does place, extra pressure on small business that are already feeling a lot of pressure.
Without intervention, experts say businesses will continue to bear the brunt of the bad behavior.
These are government policies, and if people are unhappy, they should be raising that with their elected politicians.
At Canada's busiest mall over the weekend, police arrested 2 people after anti-vaccine protesters stormed the Eaton Centre. Ontario's Minister of Labour and Minister of Health offered little more than platitudes.
Angry confrontations where people can be hurt is not all right.
You can't refuse me service.
But it's happening. Near Kingston, this coffee shop owner was berated after asking a maskless man to wait outside.
You're what's wrong with this country. I hope you understand that.
Get out of my coffee shop!
Rattled and down a customer. For some, following the rules means losing a sale.
10 to 15 customers a day, it adds up.
Taking a hit on profit.
Health workers in New York are facing a new ultimatum this week as new state mandates now require them to be vaccinated for COVID-19 or lose their jobs.
Decision day in New York, where healthcare workers faced a choice: get vaccinated or lose their jobs. Nurse Diana Marciano is one of the holdouts.
I'm scared because they're threatening my livelihood.
With doctors and nurses already stretched thin, losing just a few workers could tip some hospitals into crisis.
Very nervous. My coworkers and I can't stop talking about how nervous we are.
The state's governor has suggested deploying the National Guard to deal with the potential staffing shortage, but isn't backing down.
I don't know about you, but I'm sick and tired of talking about COVID.
Controversial as they may be, mandates have proven highly effective. From the U.S. military to private companies like United Airlines, which reports 98% of staff have now taken the jab.
The vaccine mandate pushback that we're getting seems to really follow the lines of the pushback that we've gotten all along about many of the mitigation strategies to try to prevent and control COVID-19.
Still, it's too little too late to blunt the current surge, which is killing an average of 2,000 Americans every single day.
That distinct minority is causing an awful lot of us, an awful lot of damage for the rest of the country.
That has given more ammunition to mandate backers, who argue the cost of not requiring immunization has proven to be far too high.
Cases of COVID-19 are seemingly slowing down in Ontario, with the latest projections reveal the province's case count has plateaued and the number of hospitalizations is going down.
COVID case after COVID case has meant a stressful start to the year for families attending this Toronto school.
It's just mind-blowing how little it feels has been done to protect the kids.
The Ontario Science Table's latest modeling shows while the province's overall case counts have flatlined, COVID infections in children 5 to 11 are still climbing.
This is the very group, unfortunately, who are going to be susceptible to case spread at this point because kids are back in school. And importantly, children under the age of 12 are not eligible to be vaccinated yet.
Pfizer has not made a submission to Health Canada to have its shot approved for ages 5 to 11, but officials hope a rollout could happen by November.
We need to slow down viral evolution, and that means having people vaccinated because they clear infections. When they clear the infection, then those viruses do not get to replicate and they have less chance to mutate.
Dr. Omar Khan points to the example of the Delta variant, a mutation ravaging the unvaccinated population worldwide. Here at home, it's clogging up ICUs in Alberta, where the COVID crisis is crashing the healthcare system. At a park in Ottawa, this first-time mom is thankful to see vaccination rates in Ontario are increasing, although slowly.
If we can protect against any kind of variant or any kind of spread, then that's something that we should do.
For the unvaccinated, like these little ones, the results can be long-lasting. The Science Table estimates 1 in 10 Ontarians infected with COVID-19 will suffer symptoms for more than 12 weeks. Doctors warn the province's positive news is precarious.
We're certainly taking the best case scenario from the modeling that was projected about a month ago, and hopefully we can continue along that best case scenario.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.